Tonight, we're on the verge of another widespread hospital strike by nurses, the largest in Oregon state history, according to the union. It's only supposed to last 3 days, but the fact that it could happen tomorrow morning has us wondering, what's up with hospital finances? Why have they fought unions and insurance companies so much lately? We'll dig into that. It's our big story tonight. Tomorrow morning, as many as 3,000 nurses in the Providence health system in Oregon may go on strike. They want better pay and better working conditions, and they say they've been bargaining for nearly 2 years with no success. Remember back in March of this year when Legacy Health Systems and the Regents, the insurance company, butted heads? Legacy said they needed Regents to pay more for various procedures to keep up with costs, but Regents said they didn't want to pay the hospital system more because their customers would get socked with the bills. At the last minute, the two sides came to an agreement. Last October, thousands of Kaiser Health employees in Oregon joined a national strike against the hospital system. They spanned a number of groups from radiology techs to medical assistants and housekeepers. They wanted better pay and job protections. At nearly the same time, pharmacy workers started a 3-week strike against Kaiser. Okay, so what is going on? We'll take a look at it in a big picture perspective. The system is still pretty much recovering from the COVID pandemic and the seismic shocks that brought to healthcare. And more specifically, hospitals say they are struggling, especially the big ones. Let's do a data dive now. This is from the Oregon Health Authority, which has a dashboard on hospitals. This is for all 60 hospitals in the state. I've selected operating margin to show you here. That means whether or not they made money. It shows us that statewide, it's been definitely an up and down journey, although the hospitals fell below that zero line there on the right side in 2022, then went up a bit, then ended the third quarter $10 million in the red. We can also break them out. This is for the 27 largest hospitals in Oregon. Also big trouble around 2022 and ended the third quarter of last year at negative $44 million. Here's a look at small hospitals, 50 or fewer beds located 30 miles or more from another hospital. It shows they came out about $4 million ahead. And here's a look at other small hospitals, still with 50 or fewer beds located within 30 miles of another hospital. They came out on the positive side by $29 million. Again, that's just for the third quarter of 2023. So you can see it's a bit of a mixed bag in there, but no doubt that the big systems are hurting, or were when those snapshots were taken of their financials. Here's one more that I wanted to show you. It's been put together by the Hospital Association of Oregon. See that red line under the 2021 and 22? They argued that without federal relief funds during COVID, the hospitals then would have been in the red, and that they would still be in the red as they are today. Here's Lisa Goodman, the association's spokeswoman.
Hospitals' finances really have been evolving for the last 4 years since the pandemic. Were it not for federal CARES Act funds, hospitals would have faced staggering losses in 2020 and 2021. In 2022, however, when that federal funding goes away, you can really see the impact. In 2022, for example, hospitals collectively posted a negative 2.7% operating margin, ending that year in one of the worst overall financial positions since we first began tracking financial data in 1993. Last year, in 2023, hospitals really only saw a modest improvement in their financial stability, with 54% of large urban hospitals and 52% of small rural hospitals reporting that they didn't get paid enough to cover what it cost them to provide care. So in 2023, hospitals posted a negative 1.3 operating margin. So it was really only a marginal improvement over 2022.
So when we see all these conflicts with insurance companies and unions, lack of money does seem to be a big reason. And why, you may be asking, is there a lack of money since prices are sky high if you ever have to go to the hospital yourself? Well, the Hospital Association says the government does not pay enough for care. They argue that hospitals only get paid 70 cents for every dollar spent on Medicaid patients in 2022, for example, and that underpayment totaled more than $1 billion. All right, we've been talking in generalities, but the Oregon Health Authority's site on hospital finances also does have specifics. So I was curious. I wondered about Providence Portland, big Providence hospital here. Here's what I found. In 2021, revenue was coming in at $1,040 million. Operating expenses, $1,008 million. Operating margin or profit was $31,800,000. And when you roll in money from their investments, they made a total of $55 million. So not so bad. But then look to the right at the next column. And in 2022, Providence Portland brought in $792 million and spent $811 million for a $19 million operating loss. That's not great. And when you take in investments into account, it was a $49 million loss. That's really not great. So the numbers are big, and in some cases they are in the red. Lisa Goodman from the Hospital Association says there are a lot of factors, but the system is under a lot of stress.
Since the first quarter of 2021, salaries and benefits alone have increased by 31%, which really reflects hospitals' ongoing investment in attracting and retaining talent. And this is significant when you consider that for most hospitals, labor accounts for more than half of their operational costs, and for some, up to 60%. So if you're a hospital who is spending 60% of its money on labor, and that labor goes up by 31%, that results in a significant impact to your overall finances. And it is an investment in the workforce, and that's a good thing, but it is putting pressure on our hospitals.
Okay. I was just anticipating some viewers saying, well, then why did they give them those great raises?
Well, we have to make investments in our workforce. That absolutely is important. But we also need our hospitals to be sustainable. So how do you accomplish both of those things? And that's what we're trying to figure out. Hospitals do want to invest in their workforce. That is important, absolutely. But we also need to be able to be financially sustainable and keep our doors open and make sure that we're able to provide care to the communities we serve, not just today, but 5 years from now and 10 years from now. So how do we accomplish that? And that's the question we're trying to answer.
Yep, that sounds like a tough one. All right, now we want to hear from you. After seeing all of that, what do you think? Send us an email, let us know, will you? The address is thestory@kgw.com, or call and leave us a voicemail. The number is 503-226-5090. We love hearing from you. Make sure you write or call. Don't leave us hanging.